The coronavirus, sized 0.1 micron, has in fact brought the world to a standstill. In normal circumstance, the transmission and cross-contamination of pathogens is not of much concern in the medical world because of the robust decontamination and infection control protocols that are currently in place. However, with the advent of SARS-CoV-2, concerns arose as to the airborne status of the virus and its ability to remain alive and virulent while suspended in aerosols. Aerosols are created in several ways, one of which is natural through speaking, sneezing and coughing. Another is artificial. Biological aerosol formation can take place during certain medical procedures. These aerosols contain bodily fluids that could potentially contain pathogens such as SARS-CoV-2. These potentially infectious aerosols could remain suspended in the air for up to 3 hours in a closed treatment room environment. As the aerosol moisture evaporates, the particulates turn into dust particulates or fomites that settles everywhere on surfaces in the surgery environment. Studies have shown that SARS-CoV-2 can remain virulent on certain surfaces for up to 3 days. Furthermore, the infective dose or minimum amount of the virus needed to cause infection remains unknown. The fact that COVID starts with a fever and then a cough as opposed to a sore throat, as with classical cold flu symptoms, indicates that a pathogen starts its infection from deep within the lung rather than the upper respiratory tract while working its way down. In industry, it is proven that particulates of 5 to 10 micron in size, when inhaled, usually penetrates up to the upper respiratory tract, while particulates size 2.5 micron and smaller, on the other hand, can easily penetrate to the alveolar levels of the lung. Since particulate sizes less than 50 micron is invisible to the human eye, and the infective dose of this virus remains unknown, it is difficult for dentists to quantify the risk posed by dental aerosols to members of staff, patients, and themselves. This has led to the introduction of a blanket FALLOW TIME system, where aerosol-generated procedural surgeries were kept standing empty for up to an hour between procedures, in an attempt to reduce airborne contamination of patients and staff members. This led to a massive reduction in productivity and an increase in surgery running costs, while cutting the earning potential of surgeries by more than 50%. We therefore developed a system that could actively and constantly measure the particulate count size 2.5 micron and less in the surgery environment, in an attempt to quantify the risk and determine the air quality before, during and after every AGP procedure. Industry standards allows for a particulate density of 0 to 20 micron per cubic meter and class this as excellent air quality. However, since the infective dose of SARS-CoV-2 is not known, we are working to achieve levels of 0 microgram per cubic meter, or as close as possible to 0, in order to negate the transmission risk as much as possible. Combined with the monitor, we introduced an extractor fan unit that could be placed as close as possible to the aerosol source or operatory site in order to limit particulates escaping into the splash zone and wider surgery environment to be suspended in the air with eventual fomite formation. These extractors are fitted with medical-grade HEPA 13 filters capable of eliminating SARS viruses, as well as plasma and UV filtration systems. It also contains carbon filters capable of trapping heavy metals such as mercury that escapes into the surgery environment during the removal of metal fillings. The system enables us to control the surgery environment at all times. It also allows us to quantify the air quality in the surgery at all times, to ensure minimizing the risk particulates in the air can pose to staff members and patients. The extractor fan is extremely effective at eliminating the escape of particulates into the splash zone, and it also acts as an air scrubber at the same time. The constant use of the extractor enables us to keep the particulate content in the surgery at 0 microgram per cubic meter at all times, therefore totally eliminating the need for fallow time between AGP procedures, as we can actually quantify the air quality and the potential risk particulates could pose. The system enables us with control and peace of mind by using the latest technology to provide the safe, effective and high quality care to our patients they deserve.